coming today. Can I just ask you all, like I'm just going to do it now, pop your phones on either aeroplane mode or someone switch it off, because we've got an hour together and hopefully we can all be sort of respectful of everyone's time. And obviously, it's just nice not to hear, you know, a sweet child of mine playing on somebody's phone halfway through the talk. We're recording the talk today as well, okay? So my name is Dr. Doug Windsor, or just Doug Windsor. I'm Dr. Chiropractic and have been for the last 14 years. I trained at the Welsh Institute of Chiropractic in Wales, in Glamorgan University, and weirdly have grown a passion for this kind of problem, so specifically a foot problem. This all started when I first went into practice. I had a patient come in. We're still friends on Facebook today, and he's now running marathons on a regular basis with his daughter. And he had a 2-year problem, and I just had to work really hard to find out why is it he wasn't getting results elsewhere. And I was kind of keen back then, and really, you know, full of energy, and I just wanted to solve this for him. And eventually we did after a few months, and so it just became something that if you fix somebody's plantar fasciitis, let me tell you, they tell everybody. So all of a sudden I just had a lot of those kind of patients. So that's been my experience, and I've had great success. So to give you an example, the last talk that we did was the similar kind of, it was one of the biggest turnouts like you guys today, thank you very much. But we had 16 new patients sign up after the talk, and 15 of those have made a full recovery, okay? And some of those have had problems for 7 years, 5 years, they had it in both feet, they've been to see lots of different people. What I'm going to explain to you today may not apply to everyone here, but it might be the answer to why you might be having a problem. So can I get a show of hands? Who is here that actually has foot pain? One hand. Wow, that's nearly everybody. You don't have foot pain?
He's with me.
Okay. We'll see how it goes. You've got an hour, so let me know. Another question is, who's got foot pain in both feet? This is really significant. Okay, so a good portion of you. So although this might apply to all of you, depending on, you know, the proper diagnosis and the way we look at it, and I'll explain all that today, and it might make a lot of sense to all of you. Who's been suffering with this foot pain, so whether it's 1 foot or 2 pain, for more than 6 months? Yeah, so that's why you're here, basically, yeah? So hopefully I can give you a reason why. So first of all, let's start off with a question. Who thinks that arthritis is an incurable disease? It's a trick question. It depends which one it is. So we get osteoarthritis, we deal with that every day, and we're really good at kind of offloading the problems, because that's just wear and tear. And there's a reason why this skeleton is standing up on its own, because it's hanging off this metal bar. But if I take that bar away, what happens? Yeah. Why? Because it's a full skeleton. Why wouldn't it just stand on its own? Exactly, muscles and nerves. So this is why we have the nerve chart here. We'll get to this in a second. So if you've got some nerves that have got a little bit of irritation, a little bit of wear and tear through life's injuries, and we get some pressure on the nerves, a 10-pence piece on a nerve reduces its contraction by 60%. So if that's happening on one side with a few different muscles, say it's the sciatic nerve, it's not going to give you pain, but there's a little bit of pressure on that, you're going to have 60% less function on this side, which is going to create imbalances. We call them subluxations, but basically it's just wear and tear on one side of the spine. That would cause arthritis. Arthritis means of joints. Yeah, arth is joint, itis is joint, itis is inflammation. Okay, so if you've got a joint that's wearing like this, what's going to happen? It's going to get inflamed. But if you can get that posture to get strong and straight and in a really good function, that's going to stop. And then what's going to happen to the inflammation? It's going to die down. Okay, so that's why we chiropractors really help arthritis all the time. Sometimes there's degeneration, which is a slightly different thing. We definitely can't help with that. That could be something that can be really, really, you know, damaging, where you've had years and years of problems. But we help with the posture to support those injuries, and that can be massive for people to get a 50, 60, 70% better you know, function in their spine, so they're dealing with less of the degeneration and arthritis on a daily basis. So that's the first thing. Secondly, we're here to talk about plantar fasciitis. Does anyone really understand the mechanism of injury? Does anyone want to tell me why? There's a couple of words that would describe it, but for everyone it's different, right? Normally there's a problem here in the plantar fascia, so it's getting overloaded. So I would say there's a number of reasons why that would happen. One of them would be if I was getting 60% less nerve contraction to my foot. Every time I walked, my foot would be flat and causing more of a stretch and more wear and tear on that. If I started running on that, again, I'm going to have a bigger problem again, okay? So it could be that you've got an injury there. So there's you've stepped on something. Very rarely that would be the problem. So we have 3 types of patients. Number 1, category 1. Somebody's been in an accident, there's an injury, it's a physical trauma, okay? So that can be a knee injury from football, it can be a whiplash from a car accident. Then we have the most common, category 2. This is where people have just left themselves, get a bit tired and a bit weak, and life's kind of pressures and age and all those kind of things are building up and causing imbalances and weaknesses, which are then causing these chronic, long-term build-ups of problems. And then we have category 3. This is where you've left that and left it, and eventually something's given way. Normally a disc in the back, where you're not supporting yourself, or a pelvis sprain, or something like this, where you just get severe pain, right? So we look at the way your body is functioning. So a foot problem for me is, do you remember that song, the knee bone's connected to the hip bone? That was actually factually correct. That was a medical song which was factually correct, because if you look at the connections here, all the way up, so your skull is actually connected to your foot as well, okay? So what does the foot require to do its daily basis? So I'm going to show you, I brought these along, and I'm going to show you these 2. One is a foot, and one is a hand. How different do they look? Not very different, right? So what do we do with this all our lives? We get to use it, we get to write, we get to do art, we get to wave, we get to hold things. What do we do with this? We cram it into a tiny, terrible shoe from day 1, from about the age of 2 or 3, and it gets locked in that shoe for, well, until now. And it gets to come out every night and kind of be underneath the, the covers and be pushed down. So which one do you think is going to work better than the other? This poor thing is getting locked up for most of its life. If you think about it, so I'm going to show you why that can be. So this is a shoe I bought to go to a wedding, right? Look at the shoes I've got on today. Hang on, let me lift it up for you, because I spend 12 hours a day in these at work. I don't get a single problem with my foot. So just so you know as well, I'm an ultra-marathon runner, and I suffered from horrendous plantar fasciitis pain as well. So that's my personal story. This one works really well. What do you think this one's going to do to my foot? Yeah. So, yeah. And the reason is that this is like a glove. It's all open and nice, and it's kind of giving me space. This is just like cramming my foot into the end. Don't get me wrong, there's a time and a place for this kind of shoe, and it has seen some action. It's seen some dance floor action at weddings. But the next day, I tell you, I was just broken. And getting back into these was like, a joy. So most of our slippers kind of look like this, don't they? The thing that we go home. So I actually run an ultra marathon once in these. Now this is a very expensive, very well-designed shoe, but not very good for my foot. So I did a Brighton to Eastbourne ultra marathon. So over the downs, took me about 7 hours, and I thought these got a lovely carbon place in them. They're over 200 pounds. These are going to be the babies, right? But what happens in an ultra marathon is your foot starts to swell, and there's very little room for manoeuvre for that. So I now choose trainers that kind of give me this kind of space, so I can do those runs. Imagine if I took your hand when you were born and put it in a big, huge, locked up glove that looked like this, right? What do you think your dexterity would be like? How do you think your writing would be? How do you think your hand would be in terms of control? It wouldn't have had all the experiences that it's had to build that up. And that's what we've done with our feet for many, many years. So that's the first thing. The lowest hanging fruit of this kind of problem is changing your footwear. Anyone can do it. So the next question is, has anybody used insoles?
Yeah.
They're quite good for a while. But there's something in medicine called Wolff's Law. Please, somebody tell me what that means. Wolff's Law means if you don't use it, you lose it. So what happens when you put an orthotic in? You start giving this the support that it needs. So for a while that can be quite useful, but eventually it doesn't work because you haven't strengthened the foot. And you haven't strengthened the connections that make the foot work. So like the calf, the hip, the pelvis, right? When I got my foot here a second, and you can see I've got pretty flat feet. These are not beautiful feet. I'm never going to make a foot model, right? And yet I'm not in pain every day, and I wear a flat shoe with no insoles. Why? Okay, anyone know?
Is it because of that?
Yeah, it gives you know what? So let me give you another. I brought another prop along. you're going to be wearing these within a week, I guarantee, right? You're going to be sat in your house. These are foot spacers. So you put them on the big toe, and it gives you a space. Does anyone want to see my bare foot? Okay. Watch this. So I can now do that. See that toe going out? Look at that. From wearing these. Let me show you my other foot, which hasn't quite got there yet. Okay? I can't do that. So it hasn't quite got there. So my right leg is obviously, I'm right-handed, so coordination in your right hand and your right foot is going to be much more responsive to, I'm going to stay barefooted for a while because we're going to see my feet a bit more later on, okay? So I use these when I sit at home, I just pop them in, I walk around the house, they feel amazing. It's actually kind of like a therapy putting these in. Your feet just love it. And it gives them that lovely sense of spread. And you just, I think it hurts a little bit at the start, but guess how many of my patients are using these? About 80%. Yeah. And they cost about £2 from Amazon. They'll even send you more than you need, so you can give them to your friend next door to try as well. So for me, plantar fasciitis has been a multifactorial problem. It's been a number of things. So the kind of footwear that you wear, how your posture is actually able to sustain your foot. But when you're in a flat foot like this, and you've got that nice wide foot, what happens is your connection with the ground becomes much more stable. Guess how much weight your feet can take? Body weight times, any guesses? Come on, somebody say a number.
2.
Keep going, keep going.
10.
5 to 6. 5 to 6 times. What an incredible piece of machinery. One of the things the one thing I want to, if I don't achieve anything today, one thing I want you all to do is be amazed and say, wow, the human body, the foot, the mechanics are incredible, right? I have some very religious patients come in, and it's hard to argue that this just evolved because it's so clever and it's so, so beautifully designed. But we found a way to screw it up. Put them in tight shoes, nice and early, trainers that go like this. That then loads the knees. So I used to have a knee problem when I was running. Since I've changed to a more flatter shoe for running, I now no longer have knee problems. And this knee, when I was in university, I couldn't walk up the stairs over the station in Pontypridd to go to my classes. I was in so much pain. My lecturers, the people who were teaching me, told me that I would never run again, I would never play football again. It was arthritis, and it was gone. These were my chiropractic teachers. They were idiots because they were working on this mechanical system that where the pain is where the problem is. When very often the mechanics of the foot changes the mechanics of the knee, and the mechanics of the hip changes the mechanics of the knee. The knee is just the piggy in the middle. So most people who have this kind of problem will have some sort of knee issue as well, because their foot is not supporting, so the knee can't be supporting. So what we tend to find is when we check your spine, let's bring this to the front now, because this is where we're going to get a little bit technical. Any electricians in the room? It's going to be a tough sell then, isn't it? So, do you all know how nerves work, how it works? It's like an electrical system, right? When you want your toe to go like this, something in your brain switches a little message, it goes down and your toe starts to move. So that's a conscious decision. So running is a conscious decision, but standing here now is subconscious. The reason all your necks aren't just going like this, without you thinking about it, is because we have this subconscious posture, right? So there's 2 separate nervous systems. One is your autonomic system, so that's your fight or flight. That's the thing where you take action. And that's the one that gets you really stressed and it gets you really aware. And if you're gonna fight or run, that's the thing that's gonna kick in. It's gonna switch things off. And then you've got your parasympathetic. This is your rest, digest, repair. This happens at night when you fall asleep or when you're nice and relaxed. So you have 2 separate nervous systems that we're working with. But when we have a blockage, very often around this area here, let's follow the nerve down and see where it ends, okay? Can you see all right over there? So basically, this is where I'm looking for plantar fasciitis problems. I'm looking here, I'm looking in the pelvis, and then whatever happens below all depends on this, okay? And I can show you that, right? So most people won't see this, but when I lean this way like that and I take my pelvis there, you'll see the arch in this side goes up. And when I go this way, you'll see the arch in this side goes up. So you can see just by moving my back and my pelvis, my feet are linked into that very, very carefully. Otherwise, running isn't just with your legs, is it? It's feet, pelvis, hips, shoulders, back, even walking requires a whole body movement. So they're working together. Most people in Western life, especially ones that sit on chairs like we're sitting on today, are gonna start to wear this area, right? and from cars. It starts at school. We have the worst chairs possible at school. Then we go to college and have those lecture theatre things where there's no gap there's a gap at the back. And then we sit at restaurants, we sit at home. We do too much sitting, right? And this starts to become an issue. Now, is this important to people? Is it important that they can get pain away from here, function better here, and get this repaired? Well, I would argue, and please somebody tell me something more important than mobility, or more valuable than mobility. Can you think of one, sir? It's pretty important, yeah?
Eyesight?
Mobility, being able to get around. And someone said once in eyesight, I agree, that is really important, but if you can't walk around with it, what kind of use is it to you? Yeah, so I personally don't think there's a more valuable commodity on the planet than your mobility. My mobility also. So I take this really seriously. So I'm not just going to look at your foot and go, oh, there's some pain there, we're going to use a laser, or we're going to use a shock wave, or we're going to give you some orthotics. I give your body a lot more respect that it's been through a lot of things in its life. So what I'm going to do is start to look at this area, take an x-ray of this area, see if there's any functional issues, see if there's any disc injuries. And what I found in all 15 of of those 16 patients was a disc injury here, where the disc is narrowed. You can see it very clearly on x-ray. So that's what we concentrated on. I'm gonna give you. Did any of you sign up on Facebook? Is that what you signed up?
Yeah.
Yeah. Did anyone read a message from Vivian Staples? She said a few words because she was one of those patients. So I'm going to read this out to you so you can get a grasp the level of kind of dysfunction that we deal with and I deal with here. So she was in the last talk, and I'll read exactly what she said, and you can make your own opinion. It does put me in quite a good light. I'm going to tell you that now. So she's right. Is there Annette Larry Webb here? Well, anyway, this message is to Annette Larry Webb. Hi, Annette. And you can find this on your Facebook ad because it's still there. I hope you don't mind me commenting, but if you're able to attend, I can highly recommend Doug at Complete Health. My 24-hour-a-day pain took over my everyday life. It's debilitating. I saw 6 podiatrists, NHS and private, plus a consultant, 3 cortisols and shockwave over 7 years, and was still in tears walking 3,000 steps a day. Does this sort of ring with anybody here? Does anybody have that level of problem? It's pretty severe, right?
I've had the injections.
Okay. I've been seeing Doug 5 months, which is roughly the time that we did the last talk, and a majority of the time pain-free. I walk between 8,000 and 20,000 steps a day. Good luck with finding someone that works for you. Personally, I saw Doug as a last resort. So pleased my husband convinced me to try it one last time. Okay? The reason I'm telling you that, because I want to tell you something even more important. I didn't touch her feet. I went nowhere near her feet. I worked here. And that's how we solve the problem of the nerve pain going down. When someone gets sciatic pain, it's an injury in the back, but where do they get the pain? Down the back of the legs. But it's not a leg problem, is it? It's a back problem, and it's really hard to get your head around that. But when you switch a light on here, you know the light goes over there. So why is it so difficult to know that if you switch here, you get a pain down here? So it's turning that pressure off those nerves is where we get the best results. And this was one of the things I said to her. I don't think you have a foot problem, I think you have a back problem, let's concentrate on that. It took months of her just trusting me, and eventually she came in one day and went, I just walked 10,000 steps a day. She even went to Love Supreme for 3 days walking around, and I can assure you, even my wife was falling apart at the end of that. It was tough. I mean, quite embarrassing that the person with the most back pain was my wife and Patrick's partner. So yeah, it's really important to understand that sometimes, if it's explained to you properly and you're given a proper diagnosis, does that make sense that where the pain is not necessarily where the problem is? Does anybody want to challenge that? Because I really feel like it's something I want to discuss with people because it's really important. Pain is a message, right? So let's use some of our patients will go to the NHS, and I've nothing bad to say about the NHS. If you're in an emergency, if you're having a really serious problem, these guys are incredible, right? A&E. But when it comes to chronic problems, not only do they not have the time, they're overloaded, but they don't have the training. Because it's just not something that is taught to them, because you can't teach them every single thing. So this is where chiropractors come in. We work over a period of time to solve the problem, then give people exercises to take their lives back. But the NHS has something called a pain clinic. Have any of you been to the pain clinic? Yeah. Okay, so bear in mind, pain is just a message.
it's a messenger, right? So if you have a pain clinic and you're trying to solve pain, is that solving the problem, or you're just removing the message? So the best example, one of my patients who drives a lot said, it's a bit like your engine light coming on, and you're just fixing the engine light, not the actual engine. Does that make sense? So I just want to get out to people, you know, if you're still suffering and you've tried lots of different things, you're probably looking in the wrong place. And that's not to say that sometimes we've had to work on the feet because there's been damage there. You know, I use class 4 laser, and I use lots of techniques to break down some of the scar tissue that builds up. So we do both ends. It's a bit like a plumber coming to your house, and you have all this water on the floor, and he says, "Don't worry, I'm going to mop the water up." But what about the leak? But sometimes it's good to do both. Yeah, stop the leak first, then come down. So if I was to treat this without sorting this out, this would still be a problem again and again. So we deal with this first, and then we come down here. If we don't find this on you, then there's usually another reason. It could be a pelvic issue, it could be a knee issue, it could be the calf, there could be something in the nerves along the way that's been injured. So we just trace that back as well. So there's always a reason. Because if your foot can load 6 times your body weight and it's getting in pain, something's loading wrong, isn't it? Yeah. So I think one of the key things that I want to talk about today is, first of all, we've got some posture. Okay. So why is posture important in this kind of issue? So we just said, depending on the position, depending on the load, if there's an abnormal load, you're going to overload this thing here. So there are 3 core essentials. We talk to every patient about this when they come in. And it doesn't matter what you come in with. This is the essentials to you staying out of this clinic in the future and not having a problem over. So first of all, alignment and posture. So if we've got misalignments here, if the pelvis is rotated and it's putting pressure on this disc, we need to realign that, repair. So that's the first thing. That's getting your posture into a really stable place. Then we need to look at core strength and stability, because if you haven't got the strength to support those changes, what's going to happen? It's going to start to go back again, because we all have this muscle memory and guarding and protection. So we look at those and we test that every single time you come in, because we want to see that that strength is returning as well as the repair. And the third thing is where we get loading of the spine. So we take a posture scan, we take an x-ray to see where your spine is loading and where we need to make those changes. And then we introduce exercises so you can literally start to take control of this yourself. And then where you go from there and what your future takes you, well, that's just your choice and how far you want to take it. But our job is not just to get you out of pain, it's to make sure these 3 things are working once you're out of pain. Part of the process is to get out of pain is to get them working, but we've got to keep testing these, because pain is just the message. Once that stops, it still doesn't mean that dysfunction is repaired. So when I sort of look at pain, I would say that this is good function here, and this is pain. So you need to be in dysfunction, 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 years and years, and all of a sudden you're in pain. And you're sort of floating between good and bad function depending on your energy levels, depending on what you do, depending on what your job is. So if we just get you out of pain, you love me, I've done a great job, you're out of pain. But guess what's going to happen very shortly? When you go back to your normal life, you're going to start going back down again. So we want you to finish back up here again and know how to maintain that and keep a strong posture. When you buy a house and you turn up and the garden's an absolute mess from years and years and years, it takes a lot of work to get that garden back to scratch, right? But maintaining it, once you've got it there, it's quite easy. Just got to mow the lawn, do some things. But so we always say, you know, a hard today pays for an easy tomorrow. So when you take action and you want to do something, it's going to be hard. It's going to be months of repair, months of work, but then you've got something really easy to maintain yourself. Does that make sense to people? You don't want to come and see me forever, do you? You don't want to spend your life coming in and out of place. What you want to do is have your life back and maybe see how far you can take that. So once you also feel strong, you want to go to the gym or you want to go for walks. Do any of you do more than 5,000 steps a day? So even in pain, you still do that. So you really understand the importance of walking. I've been someone that does a lot more. So when I do an ultra marathon, let me confess something to you. An ultra marathon is an eating competition where you get to do a bit of walking and running in between the eating stations. Right? So I just go to the eating station, load up on food, and then try and get to the other one as quickly as possible. And when I get a hill, I walk, because why would I run up it? And when I go downhill, I go up, run down there, because that's easier. So having that understanding has helped me do a lot more walking, and I found my health And I looked into some of the reasons why walking is so important in comparison to running. Running is an impact sport. And if you've got plantar fasciitis, that's the worst thing you can do to your foot, right? But I wanted to run, so I looked a bit deeper and I solved my problems, solved other people's problems. But if you can just get walking more than 5 to, I think it's 7,000 is kind of like the goal. I know they said 10,000, but that was just kind of like an arbitrary figure that some Japanese man said, and it is great for you if you do it. But 7,000 is the key, where you can drop all mortality by 50%. Obviously, different people are going to have different issues, but that's a pretty big figure. And all you've got to do is an hour walking every day. And I try to introduce micro walks to people that don't walk very often. So 10 minutes here, 10 minutes there, and it builds up and you count those out throughout the day, especially people in pain, because they start to get pain after a certain point. So go to that point, stop, take a rest, do it again, stop, take a rest. Make sense? Any questions?
I have a few.
Go for it.
Why?
You get 2.
3, please.
Okay, 3. Go on.
Why is it when you stand up after a while you've been sitting down, the first pain is terrible,
Yeah.
but you get used with the pain, or
Yeah.
after 5 minutes it's not there?
Great question, great question. Does anybody kind of really,
Yeah.
that's a great question. So we find this, with plantar fascia, I call it plantar fasciopathy because there's not actually no arthritis there. It gives me a chance to talk about this. There's no arthritis in most people's foot problem. It's called opathy, so there's damage there, but it's not necessarily any inflammation. And we find this in loads of research, so they call it plantar fasciopathy. So what essentially is happening is, because your foot is weak, every time you kind of stop working, your body is trying to repair that. So when you offload that foot, that's the signal for your body to start to repair. So when it starts to repair, then it puts inflammation into that area, which is painful. So any repair, so if you have a cut, it's painful, right? It's inflammation that's repairing it, forming a scar. If you have an injury, it's inflamed because it's your body repairing. So inflammation generally is a good thing. So what happens when it's mainly at night when you've rested. So remember I said earlier, we've got 2 nervous systems. One is rest and repair. Guess when that happens? When you rest. So when your body starts to repair, it feels like it's got a chance to go to that area and start working on it. When you're walking around normally, it won't, because it's switched off. So when in the morning normally, or you've rested for a while, that thing is activated, but as soon as you step down, you haven't switched it off. So you've got all this inflammation and sensitivity and the nerves in that area as well. There's lots of nerves, because your foot is one of the most important sensory function tools that we have. Your hand is incredible. Look what it can do. And if I poke you in 2 places here, you're going to feel 2 places. If I poke you in 2 places here, you only feel 1, because it doesn't have enough sensory information. If I poke you 2 places in your foot, you're going to feel 2, because it's got so much information. The fact that we've switched that off with years and years of locking it up in horrible shoes. So basically, there's still a lot of sensory information there. So when you put your foot down and you've got that inflammation, immediately that's going to fire off those nerves, right? But when you start walking, that inflammation disperses, because it's a fluid, it's a liquid, it's a chemical, sorry. So and then your body starts circulating fluid, starts circulating blood because you're moving, but it hasn't been for a while, has it? It hasn't been using that motion. Does that answer your question?
Yes. My first question.
Number 2. You're like a plant, like someone I literally is like a member of staff that we put here. Go on.
The second one is there a connection between vitamin D, living in UK, which we know we don't have much sun?
I'm from Wales. This is like I'm in the Bahamas here in Eastbourne compared to Wales. Go on, sorry.
And inflammation?
Yeah. So just so I can fill you in another little bit of my experience. When I did a master's degree, it took me 5 years. I have to do a thesis, and a thesis is a 15,000 word dissertation, if you like, but it's bigger, right? And I did mine on inflammation, diet, and pain. Okay, and vitamin D3 and K2 came up as one of the most important parts of the inflammation repair system. So we advised vitamin D to people because it helps repair. It does tons of other things. What I found out in research was all different views of how much you need. So, but the one that everybody agreed on was at least 4 hours full body. So not 4 hours with just your neck and your hands. So if you were in a pair of shorts and nothing else, maybe that would be 4 hours before you could get enough vitamin D per day. So would you say we're getting that every day in the UK?
Not
Would
in
you
an
say-
office,
yeah.
Not working in an office.
So when you get advice, and it's always terrible advice from the government, it's always nowhere near like researched and the right advice. When you get advice that you need to take vitamin D and they say 400 IUs a day, guess what the actual figure is to take a
10,000.
what's that?
10,000.
Well, 10,000 would be more than you need. That would be if you're training, if you're doing lots of things. But about 4,000 is enough to replace what you've lost in that. So it can be, obviously it's going to be different for lots of people. Right? Some people absorb heat, sun better than others. So darker skin is actually reflected, so they don't take as much in. So this is something you have to kind of figure in. I mean, I suck it up. Look at me. I'm like one of those fish you see in the sea. You can see through them, you know. And I find that depending on your skin color, your culture, your history, 4,000 to say 6,000, maybe even to 10,000 for darker skin is going to be, you know, a really good place to be. You cannot overdose on vitamin D. It is impossible because it's one of those vitamins that are actually soluble, and in a way your body just gets rid of what you don't need. So if you're taking 10,000, you've got very expensive urine. Yeah, but 4,000 to 6,000 is going to be a really good place to start replenishing what you lose through the winter here. And I find that I started taking it like 15 years ago when I qualified, or 13 years ago when I qualified, and I've never stopped taking it. And the supplements that I take, I can talk to you about a bit later, because they're all built to kind of just keep me functioning, keep me young, keep me healthy. I got a very physical job. I'm on my feet 2 days of the week, 12 hours. I never get any problems. I go to the gym 3 times, I go running, I do all kinds of things. I have a wife, 2 dogs, a bit of a life where I go and meet friends and things. And I very rarely feel like I don't want to do those things. I don't really feel that, because vitamin D is gonna make you feel older if you're not getting enough. And also there's another aspect. So when I talk about walking, and I talk about being in pain, for me, if you've got foot pain, you can't walk as much as you'd like, correct?
Yeah.
What does walking help more than just your physical health? I set that up for you then, didn't I? So this put us another layer of importance to me on this, and on this is if I can get you walking, I can get you physically better. If I can get you walking further and feeling like you're not in pain, how do you think that's going to affect your general life and happiness? Because vitamin D is another thing that I find losing out on sun has a depression element to it as well. That's why vitamin D is also really good. We found out that was a big factor as well. But if you're out walking, go to the woods and see if you can see someone that's not smiling. It's impossible. Even though there's not lots of sun coming through, they've got oxygen as well. So being outdoors is not just that. It's just having, the mobility, being able to see people, walk along the seafront. I like simple things. I don't drive a flashy car. I don't have a flashy house. I love having a place to live where I can go out and walk and enjoy that. So for me, it's a really big part of my life, and I want that for every patient that I see, because that's the thing I love the most, and I want them doing the same. And again, you can get there progressively with baby steps. Number 3, sorry.
Brilliant answer, thank you. Number 3 is a bit more personal. I was told I'm very flexible, and that's genetical. And my feet doesn't support my body weight because they're very wobbly.
Yeah. Did that person x-ray your spine, check all your function?
No.
And you probably shouldn't listen to that person unless they've done a full exam and they know what they're talking about. The amount of people we're getting here who've been told this, told that, told this. You just saw here 7 podiatrists, a consultant, and they're all the top person in their field. I mean, I've been doing this for 15 years. Every surgeon that's wrecked a patient's spine was the top person in their field. They can't all be. So just know, madam, you're next. Sorry, okay.
When you keep talking about 6,000 to 10,000, what is that, milligrams?
IUs. So whenever you get a bottle, it'll say it on there. It'll say 6,000 IUs. So that means international units. Yes, I remember that. Good question. And again, this is just my understanding of the research. I am qualified. I was a nutritionist before I was a chiropractor. I worked as a private chef and nutritionist before I was just a nutritionist. So I have a really good understanding of what I'm talking about. But again, everybody, it's a personal thing. I get blood tests done. I go to, you know, whenever we go to Brazil, I get a full workup over there. And do you know what they recommend when something's down? Supplements, not drugs. Yeah? One of the questions we ask all our patients when we do our consultation, and I really hope if any of you want to kind of take that step, you're going to get a much deeper look into your personal problem. But one of the questions we ask at the end is, how committed are you to solving this problem without the use of drugs and surgery? Because I treat a surgeon and have, you know Joel, we've been treating a foot surgeon, funny enough, for about 9 years. And one of the things he said to me when we first met, because I was really interested in what he does, and I've learned so much about this, and I used to get a lot of referrals through, am I correct? Because we used to be in Hayward Heath, and that's where he works, but I moved down here now because it's nicer. And we used to get a lot of referrals through him directly with things that had gone wrong or things that we could help them with, and I could help those patients a little bit with the nerves, that kind of thing. But one of the things he said was, surgery should be the last resort because it's not the best resort. And I think this idea that you can go to a doctor, does anyone know what the word doctor means? Come on. Have a guess. Because you go and see them and you don't know what it means. Surely you'd want to know who the guy you're seeing is calling himself. So doctor is from the Latin docere, and it means to teach. So that's why I can still feel like I call myself a doctor today, because I'm teaching you. And the more you know about your health, the better you can make decisions, whether you come and see me, someone else, or anybody else, or you make decisions about your footwear, because I've taught you something, or pushed you in a direction where you can teach yourself. So is that a doctor? Right. So when you go and see your medical doctor, does he teach you anything about your health? What does he do? He gives you tablets. Why? Because guess who pays for his training? The pharmaceutical industry.
Yeah.
We just went to a seminar, right? And I'm not having a go. You know, sometimes they can help people massively in lots of ways. Vaccines, all this kind of thing. I totally agree with, right? But we just sat down in a seminar with the top cardiologist in the country. I can't remember exactly his name because he's kind of an Asian fella. I can't pronounce his name, right? And that's not me being racist. I just literally can't say it. But he's a really, really clever guy. He's the head cardiologist in the UK. And he came and talked to the chiropractic seminar because he wanted to talk about drug research. And what he found when his father died from the vaccine, that the vaccine was set up in studies that had side effects that seemed very low, right? Remember they said there's hardly any side effects. What he found out from the actual people that did the research was they just, if anyone had side effects, they just took them out of the study. There's a way to solve your side effects problem, right? Many people died, and they just put them outside in a skip, presumably. So you can't always trust this mechanism because it's very, very money-based. And I think, and what, does any of you know what happens? Every time you're given drugs of any kind, statins is the big one at the moment, do you know your doctor gets paid a payment for that drug?
Yeah.
Do you know that?
Yeah.
And that's, you can read books about it. There's a guy called Patrick Holman, something, he's written books on it. And they should tell you that. They should tell you that they have skin in the game, that they're going to get paid directly for giving you that drug.
Every prescription.
Every prescription. Do you know when you get a flu vaccine, they get 12 quid.
Yeah.
This came straight from the horse's mouth.
Yeah.
This is the guy. And he told us all the books, all the research. Go and ask your doctor, do you get paid every single thing you give me? And see what they say. Okay, so you know, don't get me wrong. When I treat your feet and your back, guess what happens to me? I get paid. So you know, horse, what's it, pot, black kettle, yeah. But we're working on a system of repair, restoration, and giving you your life back, not giving you something to cover up the problem. So if you shoot the messenger, the problem still exists, right? Madam?
I'd say something to support what you're saying. First of all, they get paid if you send your blood pressure reading in as well. That's another thing.
Wow.
But, yeah. So every blood pressure reading they receive, they get money for all those.
You have to do
But
your own.
what my point is exactly what you're reinforcing is about what doctors don't do, and my experience of the system, because I've got 2 brand new knees at a very young age, is they don't treat your body as a whole. So I had, as a child, knock knee, which most people in the room will know what that is. It's where your knees. So of course my feet are in a knock knee position now with 2 straight legs. So of course my feet don't understand. Now when you say to your knee surgeon, but what about my feet? Oh no, that's not the only department in that's the problem with our health system, is there is anybody, I work in health, anybody who tells you that our health system, they're going to deliver you holistic care, just throw the book out the door, because it's not true. This is holistic care because this is considering where and what the effects are and how something interlinks with something else. What you get from the NHS is not holistic
The
care.
scariest thing for me is, and I think Albert Einstein said this, the most dangerous people are not the people who know, it's the people who don't know and think they know. And that is what, in 9 years of training, and again, I feel like I'm having a go at MDs, but I'm not. I'm just trying to give you an example of why it might not be the best choice to go down that road when you've got a physical, mechanical issue that is more complicated than just something can be solved with a painkiller, okay? In 9 years of training, I would say, in my opinion, and please come on, challenge me on this, the two most important things in anyone's health, in this room or anyone else, is diet and exercise.
Yeah.
Right? I know you could say, well, mental stress, yes, but diet and exercise are the two things that really set the. So how many hours in 9 years of training do the pharmaceutical industry give to their GPs in 9 years? Have a guess. Come on, let's have some guesses.
Zero.
It's actually 10 hours combined. 6 of one, 4 of the other. 4 of nutrition, 6 of other. I actually had a patient come in the other day, and they tried to put her on statins, and she said, can I try changing my diet? And the doctor said, I don't think that's a good idea. And there may be a reason for that, but she didn't give a one. So I think sometimes, it's not, again, I'm not having a go, I'm just saying there's certain things they are good at, and there's certain things that they should know that is probably best left to other practitioners. And I'm not saying that's me. Sometimes it can be many other people. There's some really good people out there, and I think it's just making a decision about your health should be based on something, at least 40 minutes of examination, spending the time with you to explain what's wrong, and then you make a decision, and then the costs are clear. So if you come and sit with me and I say, look, this is the problem, here's the x-ray, here's a report, we give everyone a full report, they take that with them. If I never see them again, they get that. I write that out for them. I take the time to do that. I go through the x-ray, we can email them to you. They're your x-rays, they belong to you, believe it or not. Every MRI you've had in the NHS, every x-ray is your property. But try and get them off, right? So we just respect your...
Stand up for it
Oh,
all.
bless. Yeah, of course you can. You don't have to ask. And if you want to go to the toilet, you don't have to ask either.
I just want to stand up for a little bit.
I'm sorry
Just
that...
get really bad back
Don't
out.
lean on the thing.
Yeah, right. Just,
So you're fitting perfectly into
yeah.
my...
Oh, I've got it all. I've got it all.
Yeah, again, like a bit of a plant.
Knee.
So it normally works on reception. Right. Yeah.
No, that's absolutely fine.
So what I'm trying to get over to you is I don't know it all. If I can't help you and I can't find the thing that I think is going to help you, we've got 2 options. And sometimes people take the second option. First option is, let's just leave it alone, we don't know what we're doing. Or, would you like me to try based on this logic? And very often people say, come on, let's give it a try, I've got nothing to lose. I had a guy come in recently, Keith, and he couldn't walk, he had a terrible hip degeneration. I took an x-ray, it was definitely something I couldn't treat, and I was very honest about it. It was horrific. He's like this every day, and he can't get an operation, even though he was in the army, he worked all his life, he's paid all his national insurance. I'm not going to go into the why, but he said to me, can you just work on it and see what you can do? And now he's doing Duke of Edinburgh with kids up in Wales. He's not perfect, but he's getting around and he's doing it. I can't even believe it myself. So sometimes it's nice to just try, and it's nice to have that option. But it's based on the honest opinion of, I'm not sure this is going to work. But when I'm sure, I'm sure. When I'm not, it's your choice. And sometimes that can be a magical thing, sometimes it can just be, it doesn't really go anywhere. So that's really what I wanted to talk to you about today, is just a chance to understand that plantar fasciitis, plantar fasciopathy, can very often be a problem that's coming from somewhere else. And wouldn't you like to think that you've done everything to try and get your posture as good as you can, support the muscles, get the strength back, get all the stability, and even if there's a little bit of pain, but your life, your quality of life, your mobility and your mental health has changed in a massive way because someone's actually put their hands on you, actually examined you properly for 30 minutes, actually explained to you everything that's going on, and then worked on you in a logical way over a logical and sensible period of time for your body to recover. If you've had a problem for 6 years, we normally put 6 months in the diary. Sometimes it doesn't take that long. If you had a problem for 10 years, we might say 10 months. If you've had a problem for 20 years, we might say a year and a half. But very often, 4 to 5 months is enough for us to turn something around that's been around for a long time. But we always give worst case and best case scenario, and everybody deserves to have their, their sort of dreams of a one-click repair. Sometimes that happens, but it's very rare. Adjustment, and if we can promise a little and deliver a lot, surely that's what everybody kind of wants from their care. And that's the thing I enjoy the most. I'm 54 now, and I come out of work with more energy than I go in, because I just love what I can do for people. But it's hard work. It's physical. It takes time. And guess what? It's boring. You have to keep coming here, keep doing the same things, listening to my dad jokes. It is a boring process. But guess what boring is? When you talk about diet, when you talk about health and fitness, boring actually gets results. So if I said to you there's one magic diet, like I'm going to give you the biggest secret of health today, okay? Does that everybody want that?
Yeah.
Right, magic diet, magic fitness plan, a magic posture rehabilitation plan for your plantar fasciitis are all the same thing. Adherence and consistency. They're boring. Everybody wants a silver bullet diet that's going to be extreme, when really just eating a little bit less every day solves the problem. A little bit more exercise every day. Everybody wants a gym plan that's going to make their muscles grow quicker than ever. Just turn up every day, keep going, and guess what's going to happen? You're going to get there. Everybody wants to be clicked and cracked and it all to get better. But actually that very often goes back to where it was. So building something gradually over time has much more longevity, much more consistency. Does anybody disagree with that? No, I've just given you the secret of life, the secret of health. Just be boring and keep turning up every day with like little blinkers on. Any more questions?
Can I ask you a quick one? Is it the same thing with you're talking about the plantar fasciitis, whatever it is underneath? But I have a lot of problems with the top of my feet.
Yeah,
Or
so
same thing?
that's the thing. The other thing with those 16 patients that booked in, only 2 of them actually had plantar fasciitis.
Okay.
Yeah, because they had foot pain, they wanted to come, they'd had it for a long time. So it depends on the mechanics of the foot, the mechanics of the knee, where you would be loading, whether you have a high heel, a high arch or a low arch, what your footwear is, what your day-to-day is. We look at all those things. And very often, when it's a problem here, it's because the arch is creating tension into the joints. So let me show you on my wonky foot. Let's go this way here. So yeah, you've got a lot of ligaments, and very often when the arch is high, I don't know whether yours is, but I'm just guessing, that's going to create more tension there when you try to lower it. If the muscles are weak here, that arch is going to start to compress in. And it's more than likely the joints are going to be the issue as well as the plantar fascia, but you might be feeling the pain there. And again, there's referral as well. So there are 2 big muscles here, the tibialis anterior, which gives pain around this area, and the ligament is here. And because the muscle is weak, you're loading too much. And then there's the calf and the soleus that comes underneath. So very often you can get pain at the back of the heel. So when it's this area here, I'm looking at this muscle, and I'm looking at the function and the arch of the foot.
Yeah, that makes sense.
Okay.
Just getting back to what that lady was saying about obviously when you stand up after sitting down it hurts like hell. With me in bed when I'm not on my feet, the buzzing.
Yeah,
What's
that's
the
because
buzzing?
that's because you have a disc problem. I mean, you just
yeah,
literally
I
told me
know.
that. So
I'm waiting for them.
I wasn't even that clever. Yeah. I mean, to be honest with you, what's happening with you is throughout the day, because you've got a disc injury, you're creating inflammation around this nerve. So that nerve then is inflamed, like friction.
Yeah.
Even if it's not completely compressed, which I think it might be a little bit. What you're going to get then throughout the day is that nerve trying to repair. It's going to be inflamed. It's going to give a buzzing sensation. Sometimes you get restless legs. Sometimes you get pain. Sometimes you get pins and needles. Sometimes you get a dead leg, depending on which part of the nerve is being affected.
Right. Okay. Yeah. I'm
So
waiting
your
for an
problem
MRI,
is
that's
probably
fine.
not anything to do with your feet. Because if you get up like that and it's painful, then it's probably something going on the feet. But if it's painful all the time, it's probably the back. Does that make sense?
Well, yeah. Well, obviously when I stand up, my feet really hurt a lot.
Yeah. So you've got a bit of both, I guess.
My
You've got
spine
the
and
leak
my
and the water
hips
on the floor. Yeah.
are really, painful as well.
So what we're going to do today, you've all got a nice little gift bag there. You've all got some information about me. I'm gonna sort of do a special offer today, and you're all going to help me try and beat the record of most patients signed in on a clinic. No, if you think there's something here today that you want to look a bit further, and you want to investigate it further, and you want to sit with me, and we spend 40 minutes, half an hour, and then another half an hour. We do 2 separate appointments because I need time to look at your case and write you up a report and explain everything to you. If you want to go down that road, in your bag should be a little voucher. What it'll say on there, normally what we charge for a consultation, we're going to include x-rays, and that can be the back and the foot, all included. And we're going to do a report of findings where we sit down and I explain everything to you, and we can send you your x-rays as well. Now normally, as a total cost, this is over £200. We've halved that price for you today, but if you actually go to the desk on the way out and you actually book it, we'll halve that again. So today the special offer is just £55. And all that's going to happen at the end of that is you're going to know everything you need to know about your problem, and then you can make a conscious decision, an educated decision on how you move forward after that.